Thank you.
All right, so if we're ready, we'll go ahead and start. I guess we will start with a motion to approve the previous minutes. Let's see, which month was that?
And they may have already been sorted through, Amlin. This was just kind of a placeholder from the template for the meeting agenda. So I'm not sure if we've had some of late since we canceled the last couple.
Can I say, because what was our last meeting? October?
Yeah, I think so.
This is the court reporter. I'm not sure you have a quorum. Is there two members?
Yep, we have Anlin and Susan, and then Marlene. If you can just turn your camera
Oh,
on.
she's not here. Okay.
Yep, Anlin and Susan, and then Marlene.
I didn't see her. I'm sorry.
Yep. Thanks, Marlene.
Thank you.
You're welcome.
Thank you, Terry.
Which, oh, I guess I did skip introductions. Do we need to go through all the members that are here?
Sure, we can do that real quick.
So we just go through and have everybody say their name and who they're with?
Sounds good.
I'll start off. Anlin Purdon, Hazelwood Home Health.
Susan Stewart, Appalachian Regional Healthcare.
Marlene Reynolds, LHC Group.
And I don't know if, do we have that on the agenda? Yeah, that comes later, so okay. All right, so we do have a quorum, but we think we've already approved all the minutes we have. Yes, okay.
Yep.
All righty, so moving on to number 3, we do have a new member of the TAC. The association voted in Evan, so welcome, Evan.
Thank you.
So moving on to number 4, recommendations, and I will turn A over to Evan.
Thanks, Alan. So this recommendation is related to the HCBS FMAP spending plan that DMS is in progress with, putting together and submitting to CMS, and our recommendation would be for that plan to include home health services and private duty services. The initial submission to CMS, I think was just focused on waiver funding and services, and we've had a couple subsequent conversations about that, but really wanted to formalize those programs being included in our suggestion and recommendation that those programs get included in the plan. So that's really it. Happy to take any questions or move forward with motion to approve that as a recommendation.
Second.
All right, motion and a second, and then Anlin, to your discretion as a vote.
I'm sorry, did we have the second?
Yeah, I think
Okay.
Susan made a second. Yep.
Yes.
Okay, ready for a vote? All in favor?
Aye.
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 Motion carries. So now, does that just go to the mic? Is that how that progresses?
Yeah, I think we include a written formal recommendation to the MAC and present that at the next MAC meeting, which I think is March 24th. So that'll
So
be the
we-
next step.
We write that and then Susan takes it to the MAC. Is that how that goes?
Or
Yes.
Evan presents, either one.
Yeah. Any member of the TAC can take the recommendations, discuss the previous meeting, take the recommendations and put them before the MAC that then formally presents recommendations to DMS and the cabinet.
And those meetings are virtual, Anlin, if you ever want to join one.
Okay.
You do want, this is Lee Geis from Medicaid. I did just want to bring this one point up. The recommendation has to be the same as you have to create the wording that you're going to take now. So if what Evan said, Evan, if you have that written down, you can, it's been read into the minutes. So that if that's the wording that you want, that's the wording that you need to take. As the recommendation.
The official recommendation is just to include home health and private duty services in the HCBS FMAP plan from DMS.
Okay, great.
So, pretty straightforward on that one.
Good. Thanks.
All right. I guess we're ready for B.
Sure, I'll do
Do you
this one
wanna-
real quick. If you want me to
Okay.
do that. And then
Sounds
Susan,
good.
if you want to add any color, but the recommendation here, pretty straightforward again, those that have been around the home health TAC for the last year or two, we've talked through the supplies orders and quantities issues with the MCOs. So at this point, just for the sake of level playing field and transparency, our recommendation would be that any supplies order requirements or quantity requirements that MCOs have be published and be available to providers in a publication. And secondarily, that we would also recommend to DMS that those orders and quantities be the same across MCOs. So you don't have to go to one MCO and have, X be the supply quantity requirement, and then to the next one, and it's X plus 10. So our recommendation is that supplies, orders, quantities, requirements be transparent and published and available for providers to view, and that MCOs be encouraged to move towards having the same requirements across each MCO.
I think Susan, did you say something, but your mute was on?
Yes, I said that's for all supplies. That's one of the hurdles we had historically is when we would get a list, it wouldn't be comprehensive. So it needs to be every supply that they cover, not just a small piece of that pie.
And it also needs to include their modifiers, because I think they like to come up with their own creative list of modifiers that nobody understands.
All right, if there's no other discussion, back to you, Anlin, for a second, and then so I'll make the motion that this be included as a recommendation, and then for a second, and then a vote.
Is there a second? All in favor, say aye.
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 Motion carries.
Good morning. I apologize for coming a little bit late. What was just you guys are recommending, if you guys don't mind?
Sure, Teos, we were just on the supplies, orders, and quantities topic. So
Yeah,
the recommendation that I put the recommendation forward that those orders and quantities and requirements be made public and transparent in terms of providers being able to know what the requirements are to order supplies, all supplies, and that DMS encourage MCOs to move towards having the same requirements across each MCO. So, you wouldn't have one requirement for one MCO and a different one for a second. So
That would be great if they do that.
All right, so I believe we're on to C. You want to take that away too, Evan?
sure. So we've had some discussion amongst our association on this, and I think where we are is we'd like to make a recommendation that for supply only patients, and I believe this is for, remind me of the specific term, Susan, because what specific supplies is this again? Handling
Incontinence.
Incontinence,
Yeah.
yes. So for that patient type that typically is supply only for an incontinence supplies, that DMS look at moving that to the DME fee schedule or payment side of things, with an ability for home health agencies that want to remain in that space, for them to be able to do it, but for that to be something in terms of program and reimbursement would be moved from the home health side of things to the DME side of things. So I think that's a pretty standard practice in other states. Kentucky was pretty unique in that regard, that it was housed, that particular program was housed in the home health program or benefit. So we'd like home health agencies, if they're so inclined, to continue to serve those patients, but for DME to be able to take over the lion's share there. So specific recommendation would be for incontinence supply only patients to now have their reimbursement in the DME program, and to allow home health agencies, if they're interested, to continue to serve those patients.
To put that in perspective for the DMS people on the call, right now in Eastern Kentucky, there's not a home health agency that really does supply only. So patients are really going without right now because it's not covered under the DME fee schedule.
Susan, are you saying that, Lee Geis again, sorry. Are you saying that there are home health agencies in Eastern Kentucky who are refusing to service supply only patients?
I wouldn't say the word refuse. I would say that's not a thing that they offer.
Oh, okay, they don't offer the service. When did they used to offer the service? Did they offer that service in prior years and have just determined that it's not, I don't know, not financially reasonable for them to engage in it? Well,
I mean, it's a multiple facet thing. It's storage, it's
okay,
ordering and receiving, it's patients want this one today, and the next time you order, they want a different one. So the margin is minimal
okay,
for the headache involved.
okay,
And so, I mean, we have very few supply only patients, and we used to have a large volume, but storage became an issue, and patients change their minds about what they want, and then you get stuck with this large boxes of stuff. But I think that it has patients are going without here because they can't get it through the DME provider. And I'm a DME provider as well. So I'm not saying if it gets moved over there that it would be any, I would immediately start doing it, because I would again have to weigh margin versus a cost.
okay, okay, thank you.
You're
Thank
welcome.
you for that kind of backstory, appreciate it.
And Lee, that's consistent feedback, across the membership, that the issues they run into are, a family might want a specific brand of a diaper, for example, that, the agency doesn't have under contract or doesn't have readily available. And, so then they've got to go try and chase down that brand. And so there's just some administrative and oversight issues that add to the cost of administering the benefit. And the result is, that thin margin that exists just sort of disappears, and it, becomes a loss leader, for lack of a better term.
I think that's kind of interesting because I'm not sure that in many other areas of healthcare that the families or the patients get to decide what it is that they want brand wise. So that's why I was very interested in that piece of information.
Oh,
That's just something I'm not used to.
Lee, I mean, they can go to a doctor and tell the doctor, I want you to write an order for XYZ, and we have to try to find XYZ.
Okay. Okay. I appreciate the information. Thank you.
And I think on our end, it's just that we don't do supplies and DMEs, that's just what they do for a living. So it's just hard for us to get it ordered, get it there on time, figure out. And we've tried it every way. We've had it ordered, shipped here in bulk, and then had patients pick it up here. We've tried sending out our aides and delivering it to them. We've had it drop shipped to the house. I've had that, it got rained on, the dog ate it. It is such a headache. And I just feel like DMEs, this is what they do for a living, and they can probably do it way better than what I do, because I do home health way better than what I do supplies.
Right. And in the other hand, we do have a large supply only program. And every now and then we do encounter some of those issues as well, but we are doing pretty well as far as providing those services. So like I said, every agency is different, but we are not having as many issues as other agencies providing supply only in our area. And that's why we want to remain providing those services.
What's the name of Mr. Perez, what's the name of your agency?
Green River District Health, Home Health.
Okay, thank
We
you.
are based out of a local health department.
Thank you.
And Lee, I'll just comment, Teotis has a benefit that some of us don't have, which is cost-based reimbursement.
That is true. We do cost settle at the end of the year as well. And that helps a lot.
Yes, it always does.
All right, do we just need to take a motion and a second and then get a vote on that? So I'll make the motion on the supply only recommendation.
I'll second. This is Susan.
All in favor?
Aye.
Motion carries. We have any old business?
That one was on there, I think, as a placeholder too. I think we've covered everything in terms of old business and the recommendations with the supplies. So should be good to go there.
All righty. Well, with nothing else, do we have a motion to adjourn?
Wait, before we adjourn, at our next meeting, could we get some updates from the MCOs and from DMS on, things that are happening in those realms? We used to get that when we met in person, and we've kind of lacked that since we've gone virtual.
If you can email me that, I will work on trying to get a representative at your all's next meeting. And let me see.
Well, right. If you put it on the agenda, I'm sorry, Erin, I didn't mean to
Go ahead,
interrupt you. If you put that on the agenda and submit your agenda in a timely manner, then that's what Erin will make sure that she tries to that she sends that out and lets everybody know what kind of updates you want, what your questions are, and who you want to respond to. Yeah.
I wouldn't say necessarily we have questions. It would just be them giving us updates on what's happening in their, like when we used to meet, you know, I can't even tell you who's over some of the departments now because we've not met in person so long. We used to have those interactions on, you know, who replaced who and such as that. I mean, I just want updates. It doesn't necessarily mean we have questions. Just tell us what's going on. Hot
Sure.
topic.
What, like I was just trying to say, you just need to put it on there if you have specific questions.
Okay.
If you don't, then, you know, just put DMS updates or MCO updates or whatever. But we kind of need to have some notice about what it is that you want. And that notice, really, that's what your agenda serves as a notice to Medicaid and to all of our MCO partners.
Got it. Thank you.
Sure.
Thank you, Lee.
Well, unless there's any other discussion or questions, I'll make the motion to adjourn.
Second the motion.
Second. Whatever you want me to do.
All right. Thank you, everybody, for your time.
Thank you. Everybody
Y'all
stay
have a
safe.
good day.
Take care.
Bye.